Hi, I'm Kelly with North Shore Eye Care. We are going to go talk to Dr. Marcantonio, which is one of our doctors of optometry. So let's go in here and see if we can ask a few questions. Hello. Do you have a moment?
Yeah.
Okay, well, if you don't mind, I'm going to just pull over a chair and I'd like to just ask you a couple of questions about what you do here at North Shore Eye Care. I said you're a doctor of optometry, but you specialize in post-op care for our surgical patients, right? Okay. Primarily cataract patients, is that correct?
Yep.
Okay. So why don't you give me an idea of, patients are always asking what is to be expected after cataract surgery. So how long is their recovery usually?
Well, usually it's 4 weeks. We do. We have a post-op care. I tell every patient it's 90 days of healing because that's when we do it.
Okay.
The first 4 weeks, the vision can fluctuate.
Okay.
Usually day one, though, after surgery, I see them right after. Sometimes I go in the OR with Dr. Martin, and I see them the day after, and they do very well. Mostly the post-op time period, I would have to say, is more like a month.
Okay.
Everybody varies depending.
So on average, a month.
Yeah, we do one eye first, and then we like to do one eye a month later.
Okay.
There's no confusion with the drops.
So then patients usually, does everybody have cataracts in both eyes, or is it sometimes just in one eye?
They can have it in one eye if there's a trauma like 20 years ago or something like that.
Okay.
Young patients can have them as well if they're asthmatic. They're on
Yeah.
steroids. You ever see that? And
That shocked me. I had no idea that somebody as young as in their 20s can get cataracts or
Sure.
have cataracts.
Yeah, they take steroids and it actually increases the risk of a cataract that actually affects the back of the lens in the eye, which is behind the pupil.
So steroid use?
Yeah, can increase the risk.
Are there any other risk factors that would cause someone younger to develop them?
Other than a trauma, not really. That's
Okay.
usually there's congenital cataracts that sometimes come when they're born. It looks like two little white spots if you ever look in their pupil of their eye.
Wow, that's
We
interesting.
monitor it, and if it progresses where it affects their vision, then we send them in for surgery.
Now, I was also told that at some point everyone will have cataracts. Is that
If we
true?
live long enough, definitely.
Okay.
Once we hit our late 40s, early 50s, the lens starts to change in the eye. So basically, people who don't know, I always tell them the cataract is actually behind your pupil.
Mm-hmm.
Okay, some patients think it's in the front, like a growth occurring over your eye. It's actually behind the pupil of the eye.
Okay.
And then by the age of 50, I tell everybody the lens starts to change from a clear lens, like a window, to starting in more like grayish color, a grayish hue to the lens, and then it progresses as we age. And then by the 60s, everybody pretty much starts to see some changes that affect their vision.
Okay, so it starts to develop then.
Sure.
So how many post-op appointments are typically involved with?
For my care,
Yeah.
I see them 1 day, 1 week, 1 month, and
Okay.
then sometimes we see them 3 months after. If it's a referring doctor, I send them back to that referring eye doctor, so they
Okay.
can do the post-op care for the other 2 months. Because we usually go 1 day, 1 week, 1 month, and then 3 months.
Okay. And what is the typical discomfort involved with the healing?
There really isn't any, I work with the best surgeon, Dr. Martin, so everything comes out perfect, which it actually does. It makes my job a lot easier. Discomfort, maybe a little stinging on the drops on day one after surgery. But
Okay.
during the surgery, we use, the anesthesia is great, if they,
Right.
use Versed. The patients do really well. A lot of them come out and say it was the easiest thing they ever did.
Would you say that the different types of cataract surgery that can be performed play a part in the recovery?
Not
Or
really, no.
results?
No, the results have come out pretty good. It's actually one of the better surgeries, and it's an easy surgery. With the different types of surgeries, we have certain kind of lenses, multifocals,
Mhm.
to help the patient see far, middle, and near. Not everybody's a candidate for that. We have some for patients who have high astigmatisms, so they're not a candidate for that lens. It's called a toric lens. It's like a contact lens that corrects the astigmatism, but in the intraocular lens, which is in the eye.
Okay.
And then the regular lens that's covered.
And how long do most patients have to wait before they can drive after having surgery?
Because they're dilated after surgery. Every patient's different.
Okay.
On day one, I look and see how dilated their pupil is. So if it's really dilated, I tell them, like a day or two,
Okay.
where the pupil starts to shrink down. Dilation, is, with the pupil, we put a drop in, the pupil gets really big. So I don't want any hazards with driving with the headlights, especially at night, because the pupil can't
Right.
constrict. Or daylight, gets
Light
really bright.
sensitivity and stuff. Okay. So it's more because of the dilation, not so much about anything
No, surgery, they
else.
come right out pretty clear, real fast. And
Okay, good.
And it's a great job. I mean, I watch patients change from not seeing at all to coming out seeing 20/20 in 70s and 80s. I mean, it's amazing.
Okay. So, just one or two more questions
Sure.
I'll ask about you a little bit. What made you decide to get into optometry?
Okay, optometry, well, that's a little story there, but I'd have to say I was pre-med at Stony Brook for psychiatry, didn't like the field. And I was
Okay.
actually bartending when I was younger. And I
I
met
feel
an
like I heard that somewhere.
Yeah, it was on
Okay.
the other video, so.
Okay.
But I actually met two doctors. I'm not going to mention their names, but
Okay.
they persuaded me to work with them, and I worked with the ophthalmologist, the optometrist, and I really enjoyed the eye field, and I totally did a total change.
Good. Thank you so much for watching our video. Please remember to check back soon and see the upcoming videos that we're going to share. And remember, if you're interested in setting up an appointment, you can call us at 631-265-8780. Dr. Marcantonio would love to meet you.